Hello, and welcome to Let My People Eat, a podcast that provides satisfying talk about kosher nutrition. Here we clear through the clutter of nutrition speak, arm you with the clarity and confidence to eat, feel, and be your healthiest every day. I am Jill Sharfman, a board-certified holistic nutritionist living in Los Angeles.
And I'm Dr. Andrea Moskowitz, a neuroscientist and psychiatrist in Los Angeles. I use my training and experience to integrate positive lifestyle changes into my patients' lives.
Hey, Andrea.
Hey, Jill. How's it going?
It's going well. So I have a question for you. Have you ever tried acupuncture?
Yes, I have. So a number of years ago, I developed plantar fasciitis, which is right, an inflammation in connective tissue around, I'm not going to go into the whole thing, around the heel. And it was really, really painful. I could barely walk. And it was very hard to put shoes on because you stretch it. And so I went to a standard podiatrist and who was very good, gave me some oral anti-inflammatory medication, which did not work. Went back to that person who said, okay, well, let's just do a cortisone shot in your heel. I was like, what? Hold on. Stop. I'm going to try something different first. So I had the name of an acupuncturist who was very good, from a friend, and I went to him for, I don't remember anymore how many sessions. I know at the beginning I was going 2 or 3 times a week for like 2 weeks, and then we sort of scaled it down. And after about like 8 sessions, even after the first session, it was a lot better. And over the next sessions, it really got completely taken care of. I was very happy with it.
That's great, because I actually have that right now. During COVID, I was walking around without shoes, and I have that, so I might have to look into. I've been doing physical therapy, but I might have to look into acupuncture to see.
Extremely
it is
helpful.
Very painful. It really is.
Okay,
it's silly.
I will tell you, the acupuncture was like, it wasn't painful, but it wasn't exactly.
So, are you afraid of
relaxing.
needles?
I'm not afraid of needles.
No, I'm
at
not
all.
either. I have done acupuncture for neck and shoulder pain, and so I am a fan. But I don't really know very much about the nuts and bolts of it. So we've invited our guest on today who knows a lot more than I do. Roy Kimia is a seasoned and licensed acupuncturist and practitioner of traditional Chinese medicine. Roy trained with world-renowned acupuncturists and traditional Chinese medicine masters and has treated thousands of patients. He created a comprehensive practice here in L.A. called the Camilla Wellness Center, where he assembled a team of remarkable practitioners who specialize in a wide range of healing modalities. And if you go on their website, you'll see there's a lot of different things they cover. As an integrative health and wellness practitioner, Roy's work addresses the mind-body connection, combining modalities of acupuncture, Chinese medicine, and energy healing. Each session begins with an ancient prayer, channeling spiritual energies and incorporating throughout the treatment. Hi, Roy.
Hey.
Hey, Roy.
How you guys doing?
We're good. Thank you so much for joining us.
Thank you for having me.
So can you tell us a little bit, let's start with the history of acupuncture, and then we'll get into the technical part of it.
Sure. So acupuncture is a 2,000-year-old medicine. I mean, it comes from the alternative medicine of Chinese medicine, and it's basically inserting thin needles into the body in specific areas that go on the meridians of the body, the channels of the body, and they help rebalance the body, help heal the body, and help bring it into the complete healing and the flow of qi, as they call it in Chinese medicine.
Right. So the Chinese philosophy about how acupuncture works and the Western medicine is different. So the Chinese one talks about the blockage in the meridians in the body.
Right.
And so they believe that this life force, which we pronounce qi, if you can unblock it using acupuncture and the needles, then you can create a flow and the body will heal itself. But Western medicine kind of has a hard time with the idea of, this life force energy. So how does Western medicine explain the idea of acupuncture?
That's a great question. I mean, you can look at it as blood flow. You can look at it as releasing serotonin, endorphins in the body. Right. And when the body gets into a parasympathetic, where the body relaxes, it's able to heal. A lot of the illnesses we see today is from not able to relax. As you know, stress can cause psychosomatic injuries and so forth. And so, when the body relaxes, the body heals itself ultimately. Mm-hmm. And so I think in Western medicine, you can look at it in that, reducing inflammation, enhancing the immune system, and so forth.
So it kind of lowers the pain threshold that people are experiencing. So maybe that makes them feel better. I know that also they say that there's a study that says stimulating the vagus nerve, which runs from the brainstem to the colon, may also help lower inflammation, which is tied to chronic pain. So by doing acupuncture and putting the needles in and causing a little bit of damage at that point, they can go ahead and heal different things. So what are some of the things that acupuncture heals?
So acupuncture is amazing. It can help pretty much it can help heal any element, really, from physical to emotional to spiritual. We have, it can help any type of pain. Obviously, we're known for pain. As you guys experienced with the plantar fasciitis, Andrea, it's amazing. I had patients with plantar fasciitis. It helps tremendously. And so I got into acupuncture myself from being in pain and lower back pain, and they wanted to do surgery on my back, and I really didn't want to go that route. And acupuncture was able to relieve it within a few sessions and putting a few points. And it's really amazing how it works. And it really gets to the root of the problem. So we can treat a lot of different things, from anxiety, depression, addictions, even reproductive health. We're having a lot of people that come in that, are having a little bit of, issues with getting pregnant. And so we are able to help them. It also helps during pre and postnatal. We have a lot of pregnant women that come to us. It can even help with oncology. I actually did an internship at the Roy Disney Cancer Center out in Burbank, and help a lot of people with their symptoms and nausea and the pain that they're going through. So it's a vast amount of things that we can help with. And we have actually on our website all the different modalities and different things that we are able to treat with acupuncture.
That's great. So Andrea, you're coming from the Western medicine, and you've experienced
sort of.
Yeah. Okay. Yes. You straddle both sides, but you've experienced acupuncture. You know it works. How do you reconcile it?
So the truth is, full disclosure. So before, I always have a PhD in neuroscience, right? So my research area was what's called endogenous opioid systems, which is sort of the opioid systems that are in our own body, not the opiates we take. So I already knew there's studies that with acupuncture for pain, that if you give an opiate blocker, sometimes it will block the effect of the acupuncture in relieving pain. So I knew already the studies, thinking that part of the way acupuncture works for pain, probably not the only way, but part of the way, is by causing release of the body's own endogenous opiates, also called endorphins and enkephalins.
Got it.
So that was like my understanding of it.
Right.
And this was a while ago.
Yeah.
And I'm sure it also causes release of other chemicals and things like that are helpful in healing.
So, Roy, when somebody comes in to see you for the first time, they're trying acupuncture, what's the process? Do you talk to them?
Right. So basically they come in, we do an evaluation. First of all, they have to fill out the medical history. We're going through their medical history. We spend a good time asking them all the questions that pertain to their main concern, look at their main concern, diagnose it, and from there do the Chinese diagnosis, which is the tongue and the pulses. And then from there I go into treating them, which can take about half an hour or so, 10 minutes to put the needles, another half an hour they lay with the needles. That pretty much covers some of what we go through.
Do you have people come in who are afraid of needles and the idea of acupuncture?
Oh yeah,
yeah. And how do you calm them down? I can't say it hurts, but sometimes somebody will put the needle in somewhere, and you will definitely feel that.
Right. It's not like pain, but it's like a little bit.
I don't know how to explain
it. It's almost. I don't want to say it's not like when you hit your funny bone, because that's like way. It's like 1,000 times worse, but it's in that kind of category. Of like, it's definitely stimulating something.
Yeah. So.
Right. So what I like to do is we really try to make it as comfortable as possible. First of all, we have the room. It's a calm room. You have the meditative music. You have the aromatherapy. So that's already getting them into a relaxed mode. I usually also put needles in the beginning that help them calm them, that don't feel like anything. And let's say they have pain somewhere that you might feel it more because, like you said, it's not really pain. It's more of like the release of what is blocked there. So, it's kind of opening up. It's like, let's say there's a river and like, let's say there's some mud there and you're like opening up and all of a sudden the flow comes in. You're able to feel more. So I feel like sometimes you might feel electricity, which is kind of considered the chi, the energy, the chashmal in Hebrew, the energy of the body, the electricity of the body, so you can actually feel it. So I say don't go, away from the pain. It's part of the healing process, really, of maybe feeling like, some kind of disbursement of energy that's blocked.
Yeah, that's great.
And I would also say, that's true for other modalities too. So, for example, with therapeutic massage, or deep tissue work or something like that, it's you feel it. It's somewhat painful, but it's also releasing. So,
right. Yeah, you can look at it that way. That's a great explanation. Yeah.
Yeah. So, you're a doctor, you're Jewish, you're Orthodox. How do you bring that into your practice? Because I know that's a big part of it.
Right. So, my experience with it was when I was, before I got into the medicine, like I said, I was in a lot of pain. One of the practitioners that helped me a lot, Dr. Yehuda Frischman, which is actually now in Israel, he had an extraordinary way. He's a Hasidic Jewish man, and a doctor, and he treated me and he taught me how to say a prayer and really act as a channel, as a messenger for God's healing. Because ultimately we can bring in our expertise and what we know, but ultimately I believe that God is the ultimate healer. So before I treat any patient, I say a prayer. I obviously ask him for permission, and then I go ahead and channel, and say Hebrew prayer that's ancient from the Ba'al Rebbe, Alav Shalom, and basically just bring that into the practice. And ultimately, a lot of the things that I talk about with my patients have to do with, a lot of the organs in Chinese medicine have to do with different emotions. So let's have somebody coming in with like back pain. It might be like an emotion has to do with fear. So I'll start talking with her, well, what is going on in your life? And where is your faith? Where is your connection to God, to Hashem, to really looking into deeper what is going on and how can you have the faith? Because if you don't believe that you can heal, if you don't have that mindset, and as we know, prayer and meditation can help heal a lot, and the mindset of a person can help them heal. So I like to put them into that state already from the start of the treatment. And once they're in that state, it's a lot easier to heal as well.
Yeah.
Right.
Makes so much sense.
It does.
And I think we forget that we have to be in the mindset. I like that a lot. Let's go back for a minute, because you talked about when you first meet a patient, you look at some of the Chinese healing benchmarks. So you talked about the tongue. Can you talk about that a little bit more? Because I find this fascinating.
Right.
It is fascinating. You can look at the tongue and tell what's going on wrong with the person, or what's going on right. Basically, if you look at the Chinese medical diagnosis tongue, you have the heart is in the front of the tongue, the sides is the liver, middle and back is kidneys and stomach. So you really have the whole organs right there. And based on the coding, based on if there's any, quiver, if there's, cracks, there's anything going on with the tongue, you can tell, whether it's yellow, whether it's white. You can tell a lot of things that are going on, and it's a very good way of diagnosing, and it's really helpful to treat the patients once you know the exact diagnosis.
Yeah, no, we just, our last guest was talking about a cleanse that she does with her program. And somebody commented that her tongue went from green to like a healthy pink after she had finished only eating the fruits and vegetables for the week and taking out sugar and processed foods. And it's such an easy thing to open up your mouth, look in the mirror and see, hey, does my tongue look healthy and pink, or are there cracks? Is there a white coating, a yellow coating? It can tell you a lot. So I love that. You also talked about the pulse. What can you tell from somebody's pulse?
So basically, it's interesting. The Ba'al Shem Tov, actually, our own ancient Hasidus master, used to take people's pulses and tell them what's going on with their body. So ultimately, it comes from Judaism, I like to say. But basically, when you look at the pulse, there's 3 pulses on each side of the right by the wrist area. And so you're looking at each pulse connecting to a different organ. So, and then depending on how the pulse comes in, whether it's very strong, whether it's weak, whether it's deep, whether it's like slipping off your fingers, you can tell what's going on and diagnose the body and diagnose that organ. And then you can go to those specific organs and specific points on the body and treat the body.
Yep. Yeah. I know they always used to take my pulse when I would come in for acupuncture. There are certain pressure points on the body that people, like, if they're not with an acupuncture practice, but if somebody feels, let's say, a headache or nausea, there are certain places that they can apply pressure and might give them some temporary relief.
Absolutely, yes. The ones that I usually like to recommend is large intestines 4, which is right by your thumb between the two, in the middle of the metatarsal there.
Can you show me on the videos just so I can see, and then I'll post it?
Right over here.
Okay.
Right.
So that's
like where
for
the web,
that's
where
for
the web.
indigestion.
Where the web is between your...
Exactly. This one is, well, indigestion also, but a lot of headaches.
Okay. That's a good one.
Headaches is a big one, and especially frontal headaches. I did a video on my website that we posted where I have a few of these points that I actually show and demonstrate on how to press them and what they help for. But yeah, this is definitely one for headache.
Right. Give me another one.
Another one. So I would say this wrist one, PC6.
Yeah.
Which is right between these 2 tendons right over here. This one helps a lot with nausea. It helps with any stomach issues.
Yes, I
actually do it a lot for pregnant women. It's a very safe point to put during pregnancy for nausea.
Right. They wear C-bands, which are something which has I know it may not be the same, but they wear the C-bands to help. And I do remember a few years ago, we went to Jackson, Wyoming, and we went in a hot air balloon ride. And we were with another family, and one of the little girls was feeling nauseous. And my daughter, Ariana, who loves this stuff, she actually did that point, and it helped the girl. And it was just really made the rest of the experience that much better. But yeah, acupressure is just a good, quick thing that we can do. Okay, something else that you do in your practice, which I have not tried, I don't think Andrea has
I have not.
either, is cupping. So we might have seen it. Jennifer Aniston, I think, was on the red carpet with the red cupping marks, and Gwyneth Paltrow has done it. What is cupping? What's the history there, and how does that help with healing?
Yeah.
Right. So you obviously saw probably in the Olympics too with Michael Phelps with his cupping. So it really helps with a lot of different things. Cupping is basically putting these suction cups on the body, whether it's using fire cupping or using plastic suction cups. And basically it helps with increasing the blood flow. It helps with any pain. It helps promote healing. and also it reduces inflammation, relieves sore muscles. So it really helps like heal the body, and actually even helps release toxins. I actually had a patient that came in, they were feeling sick. We did a few of the, cupping on them, and it released a lot of the toxin, and they felt great afterwards.
Okay.
So how does it do this? So if anybody wants to see, you can go online and see what it looks like. It's like these little glass bulbs. And if you do the heating method, they heat them up, they put them on the back, and then because the oxygen decreases, it pulls the skin into the cup.
Right.
And how long do they stay there? How long do the cups stay on the back?
So it depends on what you're treating, but I would say anywhere from 5 to 15 minutes.
Okay. And then they leave these bruises, basically.
Right.
How long does it take the bruises to heal?
It would, depending on the person and how strong you do the cupping, I would say anywhere from 3 to 7 days, something like that.
3 to 7 days. Okay. So again, this is something that's been around for a while. It does help with qi, right? Getting the life force going. The famous Taoist alchemist and herbalist Ji Hong, he was supposedly the first one who practiced cupping back in 281 AD. So it's, again, been around for a long time. And many Taoists believe that cupping helps balance the yin and yang, or negative and positive, that's in the body. So we always have to keep the balance between those two things even. Because if the body's out of balance,
right,
we do have a problem. So what happens when, so improves blood flow and then the body heals again itself, right? Is that?
Right. It kind of brings up stuff to the surface and promotes the blood flow. And when you put that fire into that cup, it sucks out all the air out, the oxygen, and creates that suction, and you put it quickly onto the body. And you can even do moving cupping, where you can put oil on the body and create that moving rotation. It also breaks up, the scar tissues and smooths the connective tissue, reduces the swelling and the inflammation, and reduces the muscle knots on the body.
It sounds painful. Is it?
It feels like a deep tissue massage. It really, it feels even better than a deep tissue massage, I would say, because it's not pushing it in. It's kind of pulling stuff out. But you really have to experience it, I would say, but it's not that painful.
Okay. Well, I might have to go experience it.
Anytime you want to come in,
that might
we'll
be,
invite you in.
That might be my next thing to go experience. Does acupuncture help with, we talked about headaches, we talked about pain, we touched a little bit on fertility. Does it help with sleeplessness? If somebody has insomnia.
Yes, it definitely helps with insomnia. It's one of the big things that we are able to treat with acupuncture. It helps with the rhythms of the body, with the sleep rhythms. It helps relax the body. And depending on the diagnosis of why the person is not sleeping, like let's say, for example, somebody's waking up at 2 a.m, we know it's like the lungs. So, okay, we got to treat the lungs.
Okay, wait. Let's talk about that, because that's another thing I love about Chinese medicine.
Sure.
The body goes, during the 24 hours, goes through processes of things move, things heal, things awaken.
Yeah.
And so there are specific times that if somebody's waking up in the middle of the night, depending on what time they wake up, it's usually very consistent that they'll wake up the same time every night. Somebody will say, I'm waking up at 3 a.m. every day. So it could be lungs, it could be liver. Can you talk about that a little bit?
Oh, yeah.
Right. So, So exactly. So about from 11 till 1 is about the liver. So let's say somebody's stressed out. They might wake up at that hour. Or let's say somebody's dealing with some kind of cough or something, some cold that they're fighting, from 1 till 3, it'll be the lungs. From 3 to 5 is the large intestine. They might have some digestive issues. So it really, but then, you have also the fact that you got to look at the other organs too, right? And see what's going on with them. Because sometimes there might be like as they call it, a disconnection between organs. So you want to make sure everything is balanced out and you're able, like you said, the yin and the yang. So if something is off in the body, we want to bring it into balance. And so once you bring it into balance, and also you can add the herbal medicine. In Chinese medicine, we have the herbal medicine that really is natural and helps the body heal itself as well naturally. Those can help with insomnia and sleep issues. So it's really helpful to use that as well.
Right. So like you were saying when I interrupted you, that if somebody's waking up and it's the lung time, I'm sure there's a better word for that. They if they help with the dealing with whatever the lung issue is, the breathing, then they will sleep better.
Right.
Right. So acupuncture, you can use acupuncture to help deal with some of those issues and unblock qi and
exactly. So you would treat, like, let's say there's some kind of issue with the lungs, you would treat that point that helps with the lungs and relieving the whatever is going on with the lungs, whether it's a cough, whether it's, sneeze, whatever it is, allergies. We can help with so many different things. So you really want to look at what's going on with the organ. Let's treat it in the right points, and whether we increase things or whether we need to decrease things. Like we said, the yin and the yang needs to be balanced. So we do what we can with the points to treat that organ.
Do you use herbal medicine in your practice? Do you recommend?
Absolutely. It's a big part of it. Between treatments, what you have is is the herbal medicine helps things going and helps really nourish the body. And if there was some kind of lung issue, you would treat with herbs that help the lung and clear out the lungs.
Right. Okay. And guys, we did an episode all about this, Mootopia, which was episode, I think, 87, if you want to hear more about herbs and Chinese medicine and healing.
Yeah. I have a question. When you use herbs with someone, are you having them use like the actual herbs where you boil it up and like make teas and stuff? Or are you using prepared products?
So in my practice, I just use the simpler ones. I just use the capsule, the product ones. We also have tinctures that are very powerful. They also come in tincture form. But again, you're able to just use it. And we have some creams as well. Okay. We haven't got to that level of having a whole pharmacy with all the herbs here raw. But we have over 300 herbal formulas, capsules, and tinctures in our practice.
Yeah, so I went to Dr. Dao in Santa Monica, who's like 20 generations of Chinese herbalists and masters and all that. And he gave me the teas to drink. They're pretty nasty.
They are. That's what I'm asking. My husband went to somebody else, and
they smell, they taste horrible, and you really feel like, I think we forgot that medicine helps you, but it not necessarily tastes good.
Right.
Like now, when they give kids medicine, they make it bubble gum or grape. Like we forget that medicine's really not supposed to taste that good. And I just remember,
it doesn't necessarily taste palatable. I mean, certain herbs are don't taste bad, but
But that I remember boiling them and
the smell.
It was a whole thing. So
that's why I found the capsules and the tinctures to be so much more useful, because first of all, people don't have to taste it, right? And then the other part is the whole boiling. It takes time.
Yeah, it does.
So I feel it to be much more efficient to be able to just give them the capsules and just use those.
Right. For sure.
Yeah. I have a question. So
sure.
Do you ever use or have you ever done acupuncture with someone during labor?
Yes.
So that they don't have to like do an epidural and things like that.
Actually, yes. One of my patients came in and she was needed to be induced, and she didn't want to be induced. And so we did some points to help induce the baby. And thank God she was, I believe, 4 centimeters dilated, and she was able to go to labor, and it was a very easy labor, thank God, and very grateful we were able to do that.
Do you ever use it for pain during the labor, or have you ever done that?
During labor itself, I had like actual labor.
Yeah.
I haven't experienced that yet.
Okay. I'm just curious.
People coming, on their 8th month and in pain and lower back pain, other hip pain or whatever it is, and we're able to sciatic pain. We're able to help with that. Very safe, very natural. I was able to. There's points to actually when a baby is breached, you can do a point for that to flip the baby naturally, which is amazing. I had a patient that came in, and we were able to do that for them, and thank God the baby flipped, and it was able to be an easy labor as well.
Okay, that's cool. That
is cool.
So right now, I think things are getting a little bit better, but I know anxiety has been a big issue over the last few months with everything everyone's dealing with. So that's something else that you can work with and
Absolutely, definitely. These days, it has been one of the main things that we've been treating in the clinic is anxiety, and we have a lot of people coming in, especially nowadays with COVID. People are more stressed, more anxiety, and so we're able to help with anxiety, with calming the body, with like the doctor said, help the parasympathetic kick in, the endorphins, and release serotonins to help heal and calm the body.
Oh, that's good. That's good to know.
Okay. We actually have a whole ebook on our website that talks about all the things that we can do with acupuncture in terms of anxiety and what it can help with.
Right. So I'm going to actually post links to those ebooks. They have one on anxiety, one on headaches, one on weight loss, and one on fertility, about how acupuncture can help with all those things. So make sure you subscribe to our newsletter so that you'll see those ebooks that could be very helpful. It's great talking to you. You can find Roy at KimiaWellness.com. So go ahead and check that out. They're also on Facebook at Kimia Wellness. Their Instagram, Kimia Wellness Acupuncture. Also, they do accept insurance. So Aetna, Cigna, United Healthcare, and Blue Cross. So I think that's great because a lot of the alternative therapies that are out there are not covered. I'm having a hard time with chiropractic. My chiropractic care right now is not being covered. And
right. So the nice thing is, acupuncture has been seen to be a preventative medicine, and under the new medical cares, they're seeing how important it is to have acupuncture and really prevent. Rather than going to these big surgeries, you can prevent the pain and prevent going into something that you not necessarily need to do. So definitely, we're grateful that the insurance companies are accepting us, and we're able to help our patients through the insurance companies. Right. The last thing I'd like to add, we do have the what my practice looks like today. Acupuncture was a big part of it, and then we added the massage, the chiropractic, the personal training, the PT, the physical therapy. We even have hypnotherapy therapists, because I really look at it as a holistic medicine, and really we have to get all the angles and working with other MDs and integrating the medicine, because that's where I see the future going, really, is to integrate the medicine and to help both through Western and Eastern, and integrate them together and help people as much as we can.
That's great.
That's a great set of services you offer. Yeah. I was looking through it. It's like,
I'm definitely going to schedule an appointment now.
Anytime you want.
Definitely going to come in and have to do the cupping and take care of my heel and all that. And now that I know they take insurance, even better. How many people do you have working for you?
So I think about 26 or so.
That's a lot. That's a
between all the practitioners.
That's a big. That's a big practice.
Thank God, we're very grateful. We've been very blessed.
Yeah, and I want to say,
great practitioners.
If you're not in LA and you can't get to Kimia Wellness, make sure if you are going to go to an acupuncturist, you go to someone who is licensed.
Yes,
they need to have L.A.C. after their name, and that they also have a lot of experience doing this and have been trained properly.
Exactly.
Yeah.
Right. Yeah. The training, it took me about 4.5 years plus to take the acupuncture boards, was another half a year. So altogether it was like 5 years of training and learning and studying, so definitely you find somebody that has been trained and licensed. For
right.
Sure.
Exactly.
And you train with other masters and people.
Right. I went to Empress College in Santa Monica,
great.
one of the best schools in the nation, and they have the masters from all around. People from China come to study there.
Yeah.
It's that good. It's been very blessed to also learn there, and thank God, take a lot. And it's a practice, so we're growing and learning more.
Yeah, wonderful. Well,
Excellent.
Thank you so much, Roy. We really appreciate
Thank you guys. Really
spending
appreciate it.
time, and thank you. And that is it for this episode of Let My People Eat. Please visit our website at letmypeopleeat.com and leave us a comment. Get in touch at our email at podcast@letmypeopleeat.com or call us at 317-659-0004. You can also follow me on Instagram at Let My People Eat.
We are also on Facebook. Search for Let My People Eat podcast to join the discussion. You can ask questions and suggest topics you'd like us to talk about in future episodes.
If you like this show, please make sure to leave us a 5-star rating and review on iTunes and tell your friends and family to subscribe to us on Apple Podcasts. Let My People Eat is proud to be part of Jewish Coffee House, where you can find your fill of stimulating podcasts dedicated exclusively to Jewish content.
Please remember that while we are certified professionals, this is not a medical advice podcast. No content, posts, or comments should be interpreted as professional guidance. Always speak to your own doctor about making the right life changes for you.
Until next time, I am Jill Scharfman.
And I am Andrea Moskowitz.
Thanks for joining us, and go in good health.